Hello, my name is Dr. Kevin Shea. I'm a pediatric orthopedic surgeon at Stanford, and today we're going to talk about avascular necrosis, a condition that sometimes affects the bones of young people. Avascular necrosis or osseous necrosis can affect any bone in the whole body. One of the reasons that we see this happen, though, is it can be after trauma or, in some cases, if you take certain medications. But what does avascular necrosis mean? Avascular means essentially without blood. So you may have areas of the bone in which the blood flow either doesn't develop normally or may fail. One way to think about this is that if you water plants, the plants will grow well. If you provide blood flow to the bone will grow well. But if you have situations or circumstances in which the blood flow or the watering to the bone is affected, that bone may not grow well. In fact, it may even die. When it dies, it can lead to collapse and failure of the bone, and that can lead to pain, arthritis, and need for joint replacement surgery at a young age. We're going to show you an anatomy model here showing some of the most common locations. This is a human thigh bone. At the upper part of the thigh bone, you have the ball and socket. This is one of the most common locations in which we develop avascular necrosis, but you can also have it form at the end of the thigh bone, what we call the knee bone, or the femur condyles, and sometimes the bone can collapse here. Unfortunately, avascular necrosis can affect almost any bone in the body, even if it's most common in the hip and knee. It can affect the ankles, the shoulders, elbows, any other joint you can imagine. When those joints are affected, you know because you may develop pain and discomfort, and in more advanced cases, your bone may start to feel as if it's catching or grinding or having some abnormal mechanical symptoms inside the joint. One of our goals with avascular necrosis is if we identify it early, we try to treat it in a way such that the bone won't collapse. Increasingly, there are minimally invasive procedures that involve small surgical implants and devices and implants of bone and cartilage and other things to restore the health of the bloodless areas so that the bone won't collapse and it'll resume normal growth afterwards. Take care and stay healthy.